We start, though, with the COVID-19 situation. South Korea set to see new cases of the virus top the 50,000 mark once again on this Friday, and experts are forecasting even more infections to come, possibly peaking sometime in March.
This comes as the country is ramping up efforts not only in treatment but also on the vaccination front. For more on this, we have our reporter Choi Min-jung here in the studio with us. Good morning, Min-jung.
Good morning.
So we hear that the total cases today is also going to be high.
Right, Mok-yeon, we're expecting to see up to or above 55,000 cases for today. This comes as South Korea already saw almost 50,000 cases from midnight to 9 p.m. Thursday. This is up by around 1,200 cases from the day before, and yet another all-time high for this time period. A medical expert in disease prevention said that cases will eventually top 200,000 per day and will maintain a peak throughout March. But at the same time, the expert also hinted that this may be the last hurdle of the pandemic. Meanwhile, as cases soar, authorities said they will be discussing updating social distancing measures as they are due to expire on the 20th of this month. Officials said they are considering extending the deadline once again, but perhaps with eased restrictions. They will also discuss what to do regarding vaccine pass mandates once current social distancing rules end next week.
And changes have been made on how people infected with COVID-19 are treated at home. Do we know how many medical institutions are looking after all these people?
Right. As of Thursday, there are some 2,400 medical institutions providing virtual treatment and prescriptions over the phone. Among them, 1,900 are neighborhood hospitals and clinics, while almost 400 are hospitals and the rest are 24-hour hotlines. Although the number of institutions participating in the service is increasing, there are still discrepancies across different regions. Medical centers that provide virtual treatment and prescriptions for those in the regular management group are mostly concentrated in the Greater Seoul area with some 1,200 facilities. However, regions like Busan, Jeju, and Chungcheongnam-do province have fewer than 100 per region, and Sejong City only 6. There are also more than 200 hospitals looking after those at higher risk in the capital region, but only 1 each in Jeollabuk-do province and Jeju. But on the other hand, the capital region only has 2 24-hour hotlines, while regions outside the capital like Gyeongsangnam-do province have more than 40. Officials say that the number of participating medical institutions will increase, and there are currently enough to manage more than 1.3 million people. As of Thursday, the number of people recovering from home topped 170,000.
And Min-jung, we hear that authorities are set to distribute antigen test kits to those considered vulnerable.
Right, Mok-yeon. The government has decided to provide the kits to students and workers at preschools as well as those in senior care facilities. Beginning the 21st, enough rapid antigen test kits for 1 or 2 tests per week will be distributed to some 2.1 million people. These people were selected as authorities say they could be easily exposed to the virus based on the time they spend in groups. Once the supply of test kits increases from next month, pregnant women may also become eligible to receive the free kits. This comes as around 70 million kits will be supplied this month and around 190 million in March. And to prevent the kits from being sold at irregular prices, the government has decided to ban online sales of the kits from Monday, and offline sales will be limited to pharmacies and convenience stores.
And finally, before we let you go, the COVID-19 vaccine produced by Novavax is now being distributed around South Korea. When exactly can people start applying to get this particular shot?
Right, Mark. Starting next Monday, the vaccine will be administered first to those at higher risk and unvaccinated people over 18. High-risk inpatients and seniors at nursing hospitals will be getting shots at the facilities they are being treated in. Other adults who haven't been vaccinated can get jabbed from Monday as well if they are able to reserve leftovers. Otherwise, reservations will begin on the 21st and they will start getting the vaccine on March 7th. People who haven't had a booster shot due to side effects from the first 2 doses are also eligible to get a booster Novavax vaccine, but they will need a confirmation from a doctor. Meanwhile, another 294,000 doses will be distributed today.
All right, Min-jung, thank you so much for your report. Have a great weekend.
Thank you.